Good afternoon and welcome to Medcom Benefit Solutions Medcom Mobile webinar. I'm Casey Hope. I'm the marketing manager at Medcom Benefit Solutions. I think some of you guys may have been on some of the webinars that Michelle Barkey and I have hosted recently. If so, welcome to the CDHP webinar. If we haven't had the opportunity to speak on the same webinar before or attend the same webinar, welcome and thank you so much today for attending. So our webinar today, what we're going to be talking about is the new Medcom mobile app, creating smarter healthcare consumers. So this webinar today is presented by Christy Crow, the Director of Consumer Driven Health Plans Division at Medcom Benefit Solutions. Welcome, Christy.
Thank you, Casey.
And I just want to go ahead and let you guys know that, as always, we are recording this presentation. We will be able to provide you with a slide deck and a link to the recording after this is over, after we wrap up. And as always, we will be taking your questions at the end. So please, if you have questions, as Christy is walking you through the steps of our new Medcom mobile app, put those questions in the questions panel, and we will address those at the end of the webinar. So without further ado, I'm going to go ahead and turn this over to Christy Crow.
Thanks, Casey, and welcome everyone. It's good to be here with you this afternoon. Today we are going to provide you with an overview of the new and improved Medcom mobile app for participants of our consumer-driven health plans, which includes FSAs, HRAs, and HSAs. We'll also touch on the registration process, how to get started, and the new capabilities that the app offers. So we're always looking for ways to bring more value to you, not only to retain your existing clients, but also to attract new ones. The new and improved mobile app is more than just account balances and transaction history for FSA, HRA, and HSA plans. It now provides a more personalized experience for employees and gives them proactive recommendations as it relates to their health care. The data is available in real time, as you would expect, and many of the methods that we make available to participants, like our online portal, is all available in real time. And so many of the features that we discussed today are available and searched and viewed in a real-time basis. As you would expect with any app, it's certainly easy to navigate. It provides an intuitive user experience. So some of the features that we'll mention today that might only be available for HSA participants would not be available for those who are not enrolled in an HSA. So some of these features are based on enrollment in a particular plan, and we'll go through those. And as you know, with security being as more important than ever these days, it's certainly safe and secure, as you would expect it to be with any kind of mobile app, especially one that may contain, PHI, with those receipts and everything, which we'll also address. Now, the registration process is very streamlined. A couple of things to note when it comes to registration is that participants who have already downloaded the app and used it in the past do not have to register again. They will simply log in with the same credentials they've had before and that they've been using. And they also do not have to download a new app. Their phones will simply update the existing app that they've already downloaded. And for many participants today, because this has been rolled out into production, they might have already even seen some of these new features. So this registration process here, it really applies only to employees who have never registered before, and they do not have a username or password to log in. They simply enter their first and last name, their zip code, their email address, their debit card number, and set up security questions. And like with most other apps, those security questions will certainly come in handy should they forget their password in the future. Now, once the employee registers or logs in for the first time on the updated app, a tutorial is available to go through the different features to kind of give them a view of where to go on the site and some of the new things that are available. That tutorial is always available for viewing later as well from the menu. And from a high-level perspective, when we're going to get into some of these items in a detail in a few moments, the app will allow participants to register their phone number for text alerts. They can add their banking information to set up direct deposit if they don't already have it. That feature was previously only available through our online portal, so now it's being filtered over to the app. Employees can load their virtual medicine cabinet. They can specify chronic conditions. They can add their health plan and set up a geolocation, whether that's near their home or their work. And the more features that the employee takes advantage of, the better the app will be personalized for that individual. Now, of course, there's lots of self-service capabilities, and we have certainly not lost sight of all of the existing features that the app previously provided. So all of those same features that employees had to utilize, track, and monitor their account is still available. For example, participants can still view all of the accounts for which they are enrolled, current and previous. They can view their account balances for those accounts, the transaction history for them. They can submit claims for reimbursement and upload receipts to substantiate debit card transactions. Bill pay features for HSAs are available on the app, and they can also view their PIN numbers if they'd like to use their debit card instead of a credit, which they have the option to do either. They can set up real-time alerts and other account-related communications. They can also update some basic personal information, such as their address, phone number, and email. And they can specify their communication preferences through the app, which was previously only available through the online portal. The app now offers biometric verification technology. You'll notice on the left side of the screen, we've added some, the right side of the screen, we've added some color coding to make it visually easier for employees to see the status of their transactions. This is in relation to the status of transactions that may need substantiation. That middle transaction right there in the red for $50, the one that's denied, either the employee it's listed there as an ineligible expense. The employee either needs to provide a sufficient receipt, repay that expense, or offset that expense. Whereas the one right below it, you'll notice is in green, it's approved, and no further documentation is required. So that provides, visually, once they go in and look at their account activity, they can kind of see that's the one I need to provide that receipt for. So one of the new features includes what we call an opportunities feed. This feed promotes activities that drive value for employees and improve their SMART score, which is also new. You'll notice on the print screen the number in the upper right-hand corner that's listed as a 61. This is the employee's SMART score. So the more opportunities the employee takes advantage of, the higher their SMART score goes. And the opportunities feed provides them with suggestions on things that they can do, including utilizing the virtual medicine cabinet. This is where they can add their prescriptions, which allows Goodbye RX to provide pricing information for particular prescriptions at different pharmacies in a geographic area, or pricing for generic options that may be available. And then for those enrolled in an HSA, the app will also prompt the employee to max out prior year contributions up to the IRS limit before the tax deadline, so they can take full advantage of the tax savings and long-term impact accruing contributions has in an HSA. And we'll talk in a little bit more about some more HSA-specific features available. Other activities that the opportunities feed may suggest is to set up direct deposit. That would only be suggested for those who do not have it already and would be set up on a check reimbursement. They can add receipts to their transactions that require documentation. And again, the more times that they do this and the more times that they fulfill the opportunities feed, the higher that SMART score will go. They can add their health plan to search for in and out-of-network providers. And HSA participants can view their lifetime spend based on known chronic conditions, which we'll talk about in just a moment as well. So I've mentioned a couple of times that employees will have the ability to search providers in their area. They can also search if they are looking for a specific procedure. So when participants are utilizing this feature, the app also includes quality ratings based on reviews from that provider, so participants are not blindly choosing a new one. The app will also provide average costs for specific procedures searched. It's interesting how little time we spend researching cost of healthcare versus how much time we spend researching other types of products that we may want to purchase. Generally, we're taking recommendations. We make the appointment, we go in, and we get that surprise bill in the end, and many times not even realizing that, hey, there was probably a more cost-effective provider available that would have also may have provided the same amount or better service and better health care. The new app provides a lot more information to participants than what was available before, so they can make better and more informed decisions. I also mentioned previously regarding lifetime spend based on known chronic conditions. The app supports the 20 most common chronic conditions for employees to enter. And for those enrolled in an HSA, the app will show them, as you can see with that print screen on the left, how their account is trending over the course of their lifetime, and will show if they have an excess in savings or if they need to contribute more to accommodate paying for those chronic conditions. So that's a really awesome new feature for those HSA participants to kind of help them stay on track with being able to pay for those chronic conditions. Many of you have probably heard of Goodbye RX. It's become very popular recently. It's a pharmacy discount card that allows participants to save on prescriptions. Now, this card can be added to a digital wallet on your smartphone. And what's really helpful is the virtual medicine cabinet, once you add the prescriptions, provides a listing of other pharmacies in a geographic location, how much that drug costs at that pharmacy, how far away the pharmacy is based on your geographic location, and the price for a generic alternative if it's available. This allows the participant to save more on their prescription expenses. And I will say that this feature, although currently only available in the mobile app, we are working to also make this available through the online portal so that employees have even more ways of keeping up with their prescriptions and looking at potential alternative pharmacies to save some money. So our new mobile app is intended to bring more value to your employer groups and their plan participants. And as I mentioned earlier, we're looking for ways to bring greater value to your plan participants outside of simply administering FSA, HRA, and HSA plans. The new app provides value to your clients to help their employees keep pace with an ever-changing healthcare system, which is difficult to navigate for those who are not in our industry. When you're not constantly looking at health plans and explaining how they work, it gets very difficult to understand all the nuances and moving parts. And all of this will lead employees to get better value out of their healthcare dollars, ultimately to lead to better health outcomes. And as we all know, healthier employees are more productive. The new app provides the same types of tools and resources your employers have come to expect across every aspect of their lives and contributes to employee retention, satisfaction, and overall health. Now, As you bring the solution to your employer clients, you're helping them realize the value they're bringing to their employees. Who doesn't want an easy way to search for providers, for procedures, to have a better understanding of how much those procedures cost and the variances between one provider to the next? Everyone's looking for additional resources to help them navigate this complicated healthcare system and provide tools to employees to make their decisions easier and quicker. So this certainly will help employees with that resource and for them to take advantage of it. At the same time, it will help employees save funds, either for other services they need for those in those spending accounts, or save those dollars for future unexpected expenses for those that are in those savings accounts. And with that, I will turn it back over to Casey.
All right, thank you so much, Christy. I really appreciate you taking some time today to kind of go over our new mobile app and everything that it can bring to employees and how it can help employers. Just want to let you guys know, Medcom Benefit Solutions doesn't stop with consumer-driven health plan administration. We offer a full range of solutions for your business. ACA employer reporting and penalty appeal support. I think currently we're sitting around about $50 million saved in potential penalties for clients. So if as ACA season starts to approach for tax filing for year 2020, if you guys are looking for a new option for ACA employer reporting and penalty appeal support, now is definitely the time to reach out to Medcom Benefit Solutions. We also offer COBRA premium billing administration, HIPAA privacy and security solutions, which means coming in to your places of work virtually, of course, now to do your privacy and security training and also that of your clients for their employees. And we also have a wide variety of health and welfare compliance and actuarial solutions. We definitely invite you guys to reach out to us or visit our website at medcombenefits.com to learn more about these solutions. Your presenters today, just as a reminder, Christy Crow, thank you so much. She's the director of the Consumer Driven Health Plans Division at Medcom, and I am the manager of the marketing team. So thank you so much, Christy, for being with us today. Now is the time, if you guys have any questions about this mobile app, the changes that are coming forward, the changes that we're implementing, anything how that's going to affect your employers and their employees, please go ahead and submit those questions at this time in the questions panel. This is kind of a look ahead to what we've got coming up in the rest of the month. Since so many people are now working remotely, Medcom is doing everything that we possibly can to reach out to our brokers, our partners, and our employers to let you guys know that we're here, what we have to offer you, and to try to give you as much training as possible. So looking forward, we have the Compliance Recharge prospecting and helping your business grow during a pandemic. That's tomorrow afternoon at 3 p.m. Next week, Recharge comes back talking about controlled groups. And then we also have the Future of ACA Reporting webinar on the 20th. What I can do is whenever I send out the slide deck and the recording for this presentation, I'm going to include the registration links for those webinars. If you are not registered and you would like to attend, we would certainly love it if you could join us. All right, and now I'm going to take some time to look at some of the questions that have been submitted. So, Christy, what is the additional cost for this app or this service?
Good question. So the app that we provide to our participants who are enrolled in, one of the benefit programs, FSA, HRA, or HSA, the app is available at no additional cost. It is free to download on both iPhone and Android. Perfect.
That's great. Do we have any marketing pieces? And I could probably take this one. Is there a marketing piece available for employees so employers can notify them of the changes? We do have marketing materials available. If you are interested, if you are a current broker partner and have clients with us with CDHP administration, please just reach out to Christy or myself, and we will definitely get you the materials that you need moving forward. Is this an update applicable for all CDHP or just for FSA?
So that it's all CDHP services. So it would apply to anyone enrolled in the FSA, dependent care, transit parking, HRA, or HSA benefit plans.
And I believe so far this is the last question that we have, but guys, feel free to go ahead and submit those if you have any more that you've thought of, but it is a good lead in for this slide. Who are we to contact if we are interested in the new Medcom mobile app or signing up for CDHP services? So these are just some different ways that you can connect with Medcom. If you're interested in our services, I highly encourage you to reach out to sales@medcombenefits.com. Our 800 number is there, and I'm pretty sure it's option 5 once you're in to get a hold of the sales department. If you have any questions about the mobile app, if you're a current broker partner with clients with CDHP administration through Medcom, feel free to reach out to myself. It's Khope, Khope @medcombenefits.com, or Christy Crow, that's C-Crow @medcombenefits.com. You can also connect with us. Make sure you're following our LinkedIn page for daily updates about things that are going on. And of course, our website at medcombenefits.com. Christy, thank you so much again for being here today and for sharing all of the information about the new Medcom mobile app. And thanks to you, all of you guys, for tuning in. We will be back in 2 weeks with another CDHP presentation, and we're going to cover a lot of everything that's new for this upcoming open enrollment season. New benefits, new ways for employees to connect and get more out of their benefits administration. So thank you guys again, and we hope you have a wonderful afternoon.